Hi, it's Dr. Lewis Clark, and I want to thank you once again for joining us on this series about dysglycemia. Dysglycemia means that you have trouble regulating your blood sugar. And we're going to break this down for you over the next few weeks in our videos. So first of all, I want to also encourage you, if you haven't already, to subscribe to our YouTube channel and click the bell so you'll get our notifications when we do our next video. And also comment. Let me know what you're learning, if you like this, if it's helpful, and certainly, of course, share it with your friends so that way they can get this information as well. This is one of the most common problems that we deal with in our office and in our society as a whole. It is a huge problem. So, dysglycemia, let me give you some of the main symptoms and complaints of people that have dysglycemia. Well, fatigue is a major problem. And especially it could be after a meal or between meals, depending on the situation. And it also can be one of those afternoon or midday crashes. Insomnia. Most people don't realize that one of the major factors in insomnia is dysglycemia, or not regulated properly blood sugar. And then these things: mood swings, anxiety, depression, some of the most common factors. Okay, then a little bit less common things like hair thinning, infertility, and even impaired metabolism, which affects weight loss. Of course, that's most people that have insulin resistant side of this also have excess weight and difficulty losing weight. So what's the step one? How do you know how to start getting better? Well, first you have to determine which category are you in. Are you in the hypoglycemic, or what's called reactive hypoglycemic category? Or are you in the insulin resistant side, which means that you have hyperglycemia, meaning your blood sugar is too high? So on this side, blood sugar is too high most of the time, because you're going to see it's not like that all the time. And over here, blood sugar is too low often, or even most of the time. And then the second step is you have to rate the severity of how bad is the situation, and how long has it been going on, and what is causing it, because all those things are going to affect your recovery. But step number one, we got to determine which side that we're on. Which category are we in? Hypoglycemic is pretty simple. The type of hypoglycemia that we deal with in our office is called reactive hypoglycemia, meaning that it's not always low, but it does become low with certain situations, and that's something that can be changed. Second is more complicated, and that is the insulin resistant side, or the hyperglycemia side, because this can be a non-autoimmune problem, it can be an autoimmune problem, or it can be from a secondary problem. So it's going to take more investigation to figure out what's going on there. So what does normal glycemia look like? Well, normal glycemia stays within a range here between typically 85 and 100. It's going to go up obviously when you eat, but then it's going to come back down. But it's not going to drop too low, then it's going to go up and down, but it's going to stay within a range. So that's normal glycemia. What's going to happen with hypoglycemia is that it may be normal at certain times, and then maybe in between meals, or because of some type of stress response or something different, it's going to drop low. And during this period where it's low is where you're going to suffer your symptoms and complaints, whether it be brain fog, whether it be fatigue, whether you can't focus, you can't think right, or whatever it may be. The other side is opposite. Blood sugar will typically be highest in the morning, and that is not because you've eaten anything, because you haven't even eaten yet, but it's because of cortisol levels. Cortisol is a hormone, it's a stress hormone, but it's most elevated in the morning, and so therefore cortisol takes glycogen, breaks it down, and brings glucose into the bloodstream. So because of that, if you have a blood sugar problem with hyperglycemia, if you have insulin resistance or diabetes, you are going to notice in the morning your blood sugar is usually the highest. And then of course after you eat, it's going to spike up, then it may drop down and spike up, but for the most of the time it's high. But occasionally it can also run low. So here's the problem. Number one, let's say that you do your blood sugar fasting, okay, in the morning and you're hypoglycemic, it may show normal. You may do your blood sugar in the afternoon with insulin resistant and it may show normal. The point is you cannot hang your hat just on one test. Too many times in my office, I'm seeing people come in and I ask them about their blood sugar and they say, oh, my doctor said it's normal. Well, how did he know? Well, he might have ran one test only, and he might have ran it at the wrong time, and he might have looked at the wrong numbers. Because medical doctors typically don't get involved in blood sugar until it starts getting into the diabetic levels, which is 126 or above, and that's way too late. So you need to know more than one test. HA1C is another test that can be used. But here's another clinical pearl. This is to help you know which category am I in. How do you feel after you eat? The question obviously now is, how should I feel after I eat? Well, you should feel the same as you did before you ate, except for now you're full. So your energy level should not increase, it should not decrease. That's critical. If your energy level stays the same as it's supposed to, then you've got a normal glucose response from that meal. That's normal. If you have an energy increase after you have meals, in other words, after I eat, wow, doc, I can think better, I've got more energy. Guess what? Your reactive hypoglycemia, before you ate, your blood sugar was too low, and glucose is fuel to your brain, and that's why you weren't able to think, focus, and really enjoy good energy before you ate. If after you eat, you have a problem with your energy dipping down, now you're insulin resistant. That means that your blood sugar went too high. Your body had to produce insulin to get it out of the bloodstream and store it as fuel for later, which is called fat, by the way. Okay, we don't want a lot of that stored around, of course, but that's what happens when we have more blood sugar than we have energy expenditure. In other words, we're not using up the amount of calories and glucose that's made, and therefore we store it as fat. So you're going to be fatigued after meals if you have insulin resistant problems, okay? So next week we're going to get into this a little bit more, and we're going to talk about some of the solutions for each of these areas, and we're going to talk about scaling a little bit as far as how severe is your condition. But first thing I want you to do between now and next time when I do the video is check how you feel after you eat. And it may be different each meal. It may be different in the morning than it is for lunch or if it is for dinner. And it also, you'll notice, is different for different types of food that you have. You may not have fatigue after all your meals, but when you have a certain type of food, you may notice I have fatigue. If you do, you're starting to learn what type of carb load you can handle, and when we exceed that, we'll go into this a lot more next time. Until then, live life well. God bless.